So today we are going to do fractional ablative laser for our patient with 2940. This treatment will need around a week of downtime, maybe a little less, 4 to 5 days, and then maybe another like 1 or 2 weeks of redness. It resurfaces the whole skin. We actually gave the patient some Valium before for sedation, and I numbed her for 30 minutes with a local cream numbing medicine. So she's feeling pretty good and comfortable after giving the pre-medication and numbing the skin. This will resurface the whole face. We'll go over all the face in a systematic manner, and because of the wavelength of the laser, it is not harmful to the eyes, so the patient is not worried. Of course, I ask the patient to keep her eyes closed all the time. We always ask the patients to make sure that they don't have any tattoos as well. It's very important to tell your provider if there's any tattoo and like microblading in the eyebrows or on the lips. So I'm making sure I cover all the areas, and I'll go all the way to close to the hairline. Sometimes I do more than one pass. So I gave here the patient, she has what's called a Zimmer chiller. It blows really cold, nice air, and the patient holds it in her hand. It distracts the patient at the same time. If there's some area that's feeling too hot, she can blow the cold air there and make the treatment even more comfortable. And the Zimmer chiller also has a gradient anyway from 1 to 5, so we can blow the air really. It's like an AC that you can control. Can be too cold, or we can decrease the amount of air blowing. Most of the time I use number 3. You can see that the patient's actually directing the hose to wherever she feels a little warm. You can see now I do under the eye. I get as close under the eyes, under the lower eyelids as possible. This will resurface that area around the eye and make really a huge difference when the healing happens. I love laser hair resurfacing and laser treatment because you are really treating the skin. You're resurfacing the skin, you're taking out all the old skin, and you're stimulating the face and the skin to produce a fresh, more healthy skin in its place. It's good to do sometimes one pass, and we can go up to 2-3 passes. It all depends on how much is needed and how the reaction, how the patient's reacting to the treatment. Now I'm going back to where I started. I go to the other side now. I almost finished a lot of the upper face and the cheeks on the right side. I'm gonna go the same thing on the left side. So the first pass, I'm doing it vertical, as you see, up, down, and sometimes with the second pass, or if I do subsequent passes, I can go horizontal, side to side. This will ensure that we're covering, more areas. As you can see, the patient is really comfortable. Her skin is really numb. And the Valium helped as well. I'm going at the crow's feet. I always say there's certain areas that we can inject Botox in, and these areas, it's good to supplement the treatment of Botox for the 11s, for the forehead, crow's feet, with laser resurfacing, because Botox works on the muscles under. It keeps the muscles nice and flat and relaxed, while the laser resurfacing actually it does treat the lines and wrinkles. The finer the lines, the better the results will be. If the lines and wrinkles are a little bit deep, then the patient might need subsequent treatment in the future. This is kind of an aggressive treatment. It is an ablative, fractionated laser. You can repeat this treatment if you want to be aggressive every 6 months, but once a year is a good medium where you really resurface the skin, and it gives you really healthy appearance of the skin if you do it once a year. The other thing that this treatment can actually treat, it treats like almost everything. You know, if there's any sunspots, if there's any superficial, spider veins, broken veins, they'll be treated. So it takes the place of IPL, photofacial. You don't need IPL if you're doing this treatment. At the same time, it targets the lines and wrinkles, and it tightens the skin as well. I'm going all the way to the chin area. It's really important to mention here that a lot of time patients have the smoker's lines or marionette lines, all these lines around the mouth. It's really hard to treat them with any other modality. You can inject a little Botox to make the area a little bit better, or you can do a little fillers in that area, but you're really not treating the area, you're just making it look better, which is great and important. But when you do this area with laser resurfacing, is the best option. Honestly, I always tell my patients for the area around the mouth, there's really nothing that will replace laser. Not even facelift, because facelift it targets more to the sides, to the cheeks, the sides of the face, and not the smoker's lines, which are the lines. They're called smoker's lines, by the way. Even if people sometimes like, I don't smoke, that's fine. Even people who don't smoke, like they come from Asian, the lines above the upper lips, the lines between the nose and the mouth. Yeah, Marsha's like telling me I don't smoke. I hear you. So now there's a demarcation, sometimes we do the neck as well, and sometimes we do only the face. If we're doing the neck, then the continuation is the same. We'll have to be a little bit less aggressive in the neck area and not overdo it, because the neck, doesn't heal as good as the face, as it doesn't have as much sebaceous glands, which help healing usually in the face. So we have to be less aggressive on the neck. If we're not doing the neck, then we do like a nice demarcation line, and do the face aggressive, and as we start to go to the jawline and to the neck area, then we do a light treatment. So the treated and untreated area will be a little bit smooth transition between the two areas, instead of like a blunt immediate from treated to untreated. And then we'll try to blend the area so it doesn't show. But in Marsha, we're going all the way to the neck, and we're covering everything there, so we're not worried about that. So I'm asking Marsha here, and she's saying that she's also feeling good. As you can see, some areas I'm gonna do a second pass. I like to do the second pass in the areas actually that tend to form lines and wrinkles, the 11s, the forehead, under the eyes, the crow's feet, the nasolabial fold, the marionette lines. All these areas are tricky to treat, and we have a lot of muscles in these areas that keep folding and wrinkling the skin. So it's really easy to form what's called aesthetic lines or resting lines in these areas. And when you supplement Botox and other treatments with laser, you really get the best of the two worlds, and you get the best results. I always tell my patients, different treatments are friends, they're not enemies, they don't replace each other. Each has its role, each one is important in its own. and when you add them together they give even like better results. This is like you see I was treating the 11 lines, and I love to focus on these areas where it's really, even there's a horizontal line usually below the 11 lines. I get a lot of complaints about that line. It's really hard to treat it with any other modality. So I'm focusing, I'm covering the patient's eye with my fingers to protect it, if you can see, so that we don't cause any harm when we're treating around the eye. Just be very careful where you go for such treatments, you know, especially when you're working on the eye. The laser can potentially be extremely dangerous to the eyes. There's even risk of blindness. So it's not a joke. Whoever doing the laser resurfacing, laser treatment for you, you should know about the wavelength, what you cannot do, what you should, how the protection should be, the safety and all that other details. Again, you can see how I'm really focusing on the 11 lines, and then I'm looking where the patient has some forehead lines or anything like that that needs to be addressed even more, and make sure that I do a second pass. Here's the crow's feet, a second pass to the crow's feet. You can see some redness, a little bit even of oozing of blood, you know, that's absolutely normal in the case of ablative laser resurfacing. We're using again 2940. This is not carbon dioxide laser. If we're using carbon dioxide laser, which I don't do for the time being at my clinic, I think it's too aggressive, then we'll see even way more bleeding. Continue addressing the areas that are problematic around the eye. Is very, very tricky area, and is very rewarding actually when you treat this area with laser, as the under eye wrinkles is very hard to treat. With Botox you can inject little tiny amount, you can do a little filler, but really doesn't help much with the lines. Again, you can see we're doing marionette lines and smoker lines. There's nothing much else you can do other than laser resurfacing, and sometimes, you know, if you're ready for surgery under the eye, then blepharoplasty, you know, is also. Here's Marsha asking me to make sure that all the smoker's lines are taken care of, and I'm reassuring her we did at least 2 passes there, so she will be happy with the results, definitely. Mental line, the line under the lower lip, is also an area that needs to be addressed. And you can see the patient is comfortable throughout the procedure. We did the important measures ahead of time. We prepared her well, you know, and then she tolerated the procedure with no problem whatsoever. She's not even flinching. So thanks a lot for watching. I hope you enjoyed the video. You got some important information. Please subscribe to our channel. You will find more videos and important information over there. If you have any questions, any comments, please write it down, and we'd love to answer all your questions. Thanks.